Hey, it's Pastor David. I'm here with my Thursday special guest, Erin Corbelli. She is the director of our human resources. Welcome, Erin. Erin, I'm really grateful that we've had these last several years to walk this journey together. You have blessed our family. I know coming in, you kind of were given a list of things that we've had to kind of shore up, and you've been chipping away at that and helping us get in line to make sure that we cover not only care of our people, but also are in line with what we're supposed to do. So thank you for that excellent work.
Thank you. This has been great.
So in terms of today, I'd like to talk a little bit about HR, and let's begin. If you tell us a little bit why you got into, or what kind of led you into this ministry, I'm calling it a ministry of HR.
I think I started off in employee benefits, ironically, and worked for a broker. But what I really like about HR is that you're representing the corporation or the organization to employees, and you're representing your employees to the organization and the leadership. And so my favorite part in this environment is that we get the benefit of being able to look at the employee holistically. Yeah. And because we all know we take work home with us, and we all know that, we bring home to work with us. And so I'm inspired by the ability to be able to practice HR in an environment where we have the flexibility and the grace and the empathy to be able to deal with people or deal with our employees where they are in their lives. And if we can help them in all areas of their lives, then they're not distracted by not paying bills or not having to worry about certain things, that they can bring their best to work every day and do, work for the church. So.
Yeah. And I really see that in what you do. I see that calling in you as you really try to help those that work among us to really bring their best and to have that kind of security in place. And so that's why I call it a ministry. I'm grateful for your ministry. Being in the church for HR probably is a little bit of a unique experiment, at least in this place. Most churches aren't the size where they get into that, but with the breadth of this church, with 2 preschools and several other organizations that deal with this, we really felt the need to go this way. And so what has been unique and maybe even an opportunity in the church that would not be necessarily true in the corporate world?
I think in the corporate world, and it's becoming increasingly more popular for organizations to be more, to take care of their employees more.
Yeah.
As opposed to just kind of doing the minimum legally of what you need to do to kind kind of get by.
The workplace has shifted that way, hasn't it? I mean, there's much more movement than it was, let's say, even when I started. It's in order to keep good people, you have to be that way.
Yeah. So what I find is that human resources, a lot of it is, while it sounds like it goes really well with the church in terms of how you're nurturing people, a lot of actual HR practice and legal pieces are kind of antithetical to church environment, right? It's like to make sure you're actually helping people, and not firing them when they get sick or those kinds of things. And so in this environment, it really is, it's fun because there's just enough space in there to be, okay, this is the legal minimum, but we're a church and we're called to more. And so if we're going to do something, we're going to do it the right way. And we're going to do it in the way that Christ would have us do it. Yeah. So, and that to me is important.
Yeah, that's really awesome. Truly. And you have certainly helped me think more in terms of that. How what are we called to do? Not what do we have to do, but what are we called to do? And particularly for those that we employ here at our church and its ministries. It's a tension, though, isn't it? I mean, because At times, we're in an environment where we feel like we should know everything, or we know everything's going on, and you have that tension versus respecting the privacy of the person that you employ, or what we're supposed to do. And there's a tension where I find, even in the 30 years I've been ordained, where what was kind of expected to be kind of looked over and passed by, now in this environment, you must more have to be vigilant about the many different liabilities in culture than I didn't even know existed 30 years ago. And so I'm sure you feel some of that tension. You
For sure.
navigated so well, and you've been a gift to us. I know that there are a number of opportunities or challenges in the HR aspect of the church, and one of them is health insurance. Health insurance is for everyone, and even for the church, a unique opportunity challenge in the coming year. So tell us, to start us a little bit, why is health insurance so important to offer to employees?
Yeah, so I think health insurance it's important to everyone, just the way the healthcare system is in this country, and the costs. It's important to have some type of coverage. I mean, we've seen that with different laws and things like that. But from an employer perspective, it's become part of the compensation package that you offer to employees. And that's really important in this environment, because we're a church and a nonprofit, and we can't maybe pay the salary rates that people could get paid in certain functions outside and more public or private corporations. And so if we're paying a little bit less, but we're offering a full benefits package that's comprehensive and in line with what other organizations are offering, and we did some benchmarking, and we do offer that. It's very important to attracting and maintaining talent that we have working at the church.
Yeah, I've certainly seen that. It really does matter. And particularly if you're looking to recruit and to bring on board younger staff, and the church has said one of its values be multi-generational. That means a commitment to providing what younger staff wants to have or needs to have, which is health benefits. And so it's part of what it is to be a multi-generational church. So first, a second, who do we, what do we offer? And what do we cover? How does that work in our church? What's our current policy?
So currently we offer for health insurance that we do have ancillary benefits that we offer, like dental, vision, disability, those kinds of things.
That they can purchase, right.
Some of it they can purchase, some of it the church provides for them on their behalf, and they can purchase additional amounts if they want. From a medical perspective, we offer two health plans. One is more of an HMO. We call this our low plan, an HMO type of product where we pay 100% of the employee only rate. And so the employee that is on that by themselves pays nothing for medical insurance. Now, if they would like to add family or spouse or children, they will pay the difference in premium through payroll deduction. And that's the same for the higher plan too. We'll cover 100% of the cost of the lower plan. They pay the difference in premium for the higher plan as well. So,
and that is, again, I think online, you said in line as you looked around to what organizations our size are offering.
Yes, we did some benchmarking through our broker this past spring, and they confirmed for us that we're offering a rich benefit plan, particularly for a church, and we're in line with deductibles and co-pays and contribution structure that other organizations have.
Yeah. So all of that means what coming into this current year? How is that playing out? I know that the insurance world right now is nuts. I mean, I think about the property insurance world, that's going to go up at least 25% in the coming year. Health insurance is also increasing year after year. What does this translate to for us in the coming year?
So we kind of are in a unique spot because first of all, we're not an anomaly as a church that can afford to offer medical insurance at all as an employee group. That we're big enough. That being said, we're not big enough to actually get rated and have premium rates based on how our population actually uses.
Are you saying that we do not have the same poll as Bank of America? Is that what you're trying to say?
Yes.
Okay.
Yes. And so basically it's a blessing and a curse. It works for us when we have, it works in our favor rather, when we have really what they call poor experience, which is people very like a sicker population, people using the insurance for lots of different things all the time. We are, not getting totally killed on an increase based on that. But the other side of it is that if we have a really healthy population and people who don't use the insurance, we're lumped in with the rest of the employee groups that carrier has that are within our size. So that translates into what we have now, which is 36% increase for 2023 and the cost of our health insurance.
36%, that translates to what amount?
That's probably, in my rough estimate, is about $120,000 in addition to what we already pay, which is in excess of 300,000.
Yeah, and so part of your role is to help us try to navigate the best deal we can. That's part of what your work is. It's part of why, frankly, we need someone like you to be in this role, because navigating this is complex and it's always changing, and every year it's up for renewal. And we're in the size where we do not command the attention of the broker that a major corporation would. And I know this has been something in my career, 30 years ordained, where church insurance has been the headache of staff parish every single year and goes up every single year. And I know this is not unique to churches, right? I think you were saying the other day that there have been examples of major corporations that have kind of imploded because the benefit packages kind of got into a big boulder in their way.
Well, if you remember back to 2008, when GM was going through the auto bailout, a large part of why, besides the market with, people not buying cars, the large part of why they were, upside down is because they had so many retirees and labor costs and pension, medical insurance, and all of those things. It's a huge expense. And so it's worth it, but it's a balance. And so we know what happens when you get too far upside down.
Yeah, it's that tension point between doing the right thing, caring for people, recruiting people with the tool you need, and trying to manage it. And that's one of the places we're in right now, right? In terms of, I'm very grateful that people have been generous to the church. We've given a little bit more than last year. So we've kind of stabilized our giving through COVID, but 36% increase for health insurance alone, $130,000 alone. Our giving is not going up 36% the coming year.
Right.
And property insurance is going up 25%. Our giving is not going up 25%. It just is not increasing at that level, which really creates some real challenges around what we're trying to do. And so I really appreciate your time today. This is part of what I wanted our family to know, that we're in this process, and it's just one piece of our process, but it's an important piece, significant piece, and a costly piece. And so we covet the prayers, our leadership covets the prayers of our family as we kind of work through this. It doesn't feel like there's a really great option forward, however you go. And so something we have to navigate. Well, Erin, again, I'm so grateful for you and for your presence. Just remind us, the family who's listening, you have a family.
I do.
You have a wonderful kids and a loving husband. Tell us a little bit about your family.
Yeah. So my daughter is 11 going on 17 and in middle school now. My son is about to turn 9 in 8 days. He reminded me that this morning.
Okay.
8 days. My husband has been actually, we met at an open enrollment meeting when I was a broker.
How about that?
He works for an insurance carrier.
Destiny. Yeah. Wow.
Yeah. And so, we're just your regular, we got horseback riding and basketball and faith formation and all those things, and working and being a family and navigating life together. And
Yeah, and I know that you're a woman of faith and that you practice your faith. You're a disciple. You're active in your church, and as you said, faith formation with your children. I know your children are not wallflowers at all, like their parents. So that's fantastic, and it's just good to be with you. Thank you, Erin, and thanks folks on the family for listening. We'll see you in church on Sunday.